This podcast, a simple summary of a scientific peer-reviewed paper, is made with the help of AI by Big Head Pain, Dr. Faraidoon Haghdoost. Today's episode covers the study OnabotulinumtoxinA treatment for chronic migraine in pregnancy, an updated report of real-world headache and pregnancy outcomes over 14 years in whole by Wong al., published in Cephalalgia in 2025. This study brings valuable real-world data to a question many patients and clinicians ask: is Botox safe and effective for chronic migraine during pregnancy? In 2020, the same team from Hull, UK reported their early experience. 45 people had continued OnabotulinumtoxinA Botox treatment for chronic migraine after becoming pregnant, with promising results. Now, with 81 new pregnancies added, they present updated data on 126 pregnancies across 14 years. Here's what they found. Of the 126 patients who became pregnant while on Botox for chronic migraine, 97 chose to continue treatment and 29 decided to stop. All 97 who stayed on treatment maintained good migraine control throughout pregnancy. In contrast, 69% of those who stopped treatment experienced a migraine relapse during pregnancy, usually around 4 to 6 months later. Importantly, there were no fetal malformations in any of the 126 pregnancies. The miscarriage rate was low, about 2.1% among those who continued Botox and 3.4% among those who discontinued, well within the expected range for the general population. Nearly all deliveries were full-term, and there were no serious complications reported. The study also followed outcomes in the early postpartum period. Even among those who stayed well during pregnancy without treatment, many relapsed within the first 3 months after birth. A large proportion chose to restart Botox or switch to newer treatments like calcitonin gene-related peptide, CGRP, monoclonal antibodies. Interestingly, those who had children before were more likely to continue Botox. First-time parents were more likely to stop, possibly due to greater caution or uncertainty. While official guidelines still don't recommend Botox in pregnancy, mainly due to lack of controlled data and concerns from animal studies, this real-world cohort provides encouraging evidence. It suggests that Botox may be both effective and safe for people who are already on it and become pregnant. As always, the decision to continue should be based on informed discussions considering each individual's history and needs. But for those with severe, treatment-resistant migraine, this study offers reassurance that continuing Botox may prevent disabling attacks without adding risk to the pregnancy.